All right, hello everyone. Welcome back to the 10th episode of the Face to Face podcast. I'm Mark.
I'm Jerry.
And I'm Sean.
And today we have a very special guest, Shannon Sock. So Shannon Sock serves as Mercy's Chief Operating Officer and Chief Strategist. Mr. Sock has earned an MBA from WashU in St. Louis.
Since he joined Mercy in 1999, he has served in a variety of leadership roles, including Chief Financial Officer, focused on major business and clinical transformation initiatives.
These include the creation of an award-winning supply chain operating division, Mercy Meds, Mercy SafeWatch, early implementation of an electronic health record, and the establishment of Mercy Virtual. Prior to joining Mercy, he worked in consulting for CSC Healthcare. Mr. Sock, thank you for being here with us today.
Glad to be here. Thank you, guys.
So sort of try to outline how you got here as Mercy CFO. I mean, I'm sure it was a long journey to get there. Can you sort of outline your professional career?
Sure. Let's just start with my story a little bit. I grew up in a small town in Nebraska, and I had an amazing high school counselor that said you should go for it and spread your wings. And there's this university in St. Louis called Washington University that I've always wanted to send a student to. And so that was me. And he helped me get here in St. Louis. And, that changed the trajectory of my life. And I think, as you kind of go through your career, whether you're in high school or college or professionally, it's great to have mentors along the way. And so Mr. Morris was my first mentor and put me on this trajectory. At WashU, I actually studied engineering and then later went to get my MBA and had no intention to go into healthcare. It was life circumstances that put me there. And when I got there, what I found was an industry that just was full of opportunity. A lot of kind of traditional ways about thinking about healthcare. It was, 1994. So think of the technology we have today that did not exist in 1994. So it was a completely different environment. But the ideas that I learned in the MBA program, my intellectual curiosity around new ways of doing things, I think gave me an opportunity to bring new ideas into healthcare very early on. So that's how I got into healthcare. It was circumstantial. It wasn't intentional. And I think, the learning from that is be open to new paths and new ideas and enjoy the journey and let it take you places. Kind of don't oversubscribe your intentions. But after spending a few years at Barnes Jewish here in St. Louis, I decided I wanted to go into consulting. And the reason for that is that, I think consulting is a great training ground for young professionals, particularly those interested in business and tech and other things. It gives you a lot of exposure to a lot of, different situations and different thinking. Generally, you're working with really, really smart people that bring their own talents to the equation. So that was an excellent 3 years in my life, kind of between my original time at Barnes Jewish Hospital here in St. Louis, and then while on the road, I received a phone call one day to come back to St. Louis and consider Mercy, and the timing was the right timing. My wife and I had started a family. I wanted to get off the road. And my son was 3 months old, and it was time to come back home. So, again, circumstantial. But was put into immediately into a position of innovation. And that became the beginning of a series of opportunities that ultimately put me in a position to be considered for the Chief Strategy Officer and the CFO and now the COO position. So it was going along for the ride and being thoughtful about the decisions I made along the way, and it's paid off.
So you got an MBA, right? So we've talked to a lot of leaders, right? We've talked to Sam Altman. We've talked to
Julia Ryu.
yeah, you could
She's
argue
like an
she's
innovator,
yeah,
yeah.
innovator.
Yeah.
We've talked to the CEO of Bank Shares, gave us some insight into leadership. So, do you think that being a leader and being a businessman, is that something that can be learned, or do you think it's more through experience? Because Sam Altman obviously did not get an MBA, but he's doing pretty well as as a leader. So, what is your stance on that?
Yeah, I think ultimately experiences shape you more than formal education. What's excellent about various MBA programs and those experiences is it teaches you a discipline, and it helps you create a network of relationships of people who are similarly ambitious, that you can lean on into the future. Obviously, there's specialization that can occur through MBA programs and that sort of thing. But I think in terms of leadership, it's self-study, it's experiences that you have, and I think it's also very much, at least in my journey, I take time to reflect on experiences and situations, and ask myself, have I handled that differently? What were the outcomes of that interaction? What have been the outcomes of the influence that I've exerted in the organization? And just force yourself to be a bit self-reflective on your experiences as you grow. And I think that ultimately shapes who you are as a leader and how you continue to engage your teams or your organizations.
I mean, building on kind of what Mark said, I mean, from a little bit of what we heard from the leaders that we talked to in the past, a lot of them emphasize the importance of communication and working with a team and being able to bring people together to reach a goal. And so how does that apply to you and your daily interactions or goals that you strive to reach?
I would just double down on that idea. Communication is so important, and strong communication, in my experience, is fairly rare. You think it's an easy thing to do. You think, of course, everybody can effectively communicate. I would say, I don't know how to quantify it, but 2 out of 10 of my interactions, even today, have, I think, effective communication amongst teams, and I think that's a result of many different things. First of all, I love Mark Twain's quote: "If I had more time, I'd write a shorter letter." And just the pace of the irony of the pace that business happens today is that communication is either way over abbreviated, or it's really long because people don't take the time to formulate their thoughts. They just spew out their ideas. And so the magic is in that balance of just being thoughtful about what you're trying to communicate, the tone that you want to communicate it with, which is incredibly important, and having some perspective on what's important and what your teams need to know and who needs to be involved in it. Oftentimes people over communicate as well. They're too inclusive in their communication. And I can't tell you how many emails I get that have 40 people attached to it, and it becomes a bit meaningless. So it's just being really intentional about communication is huge, and put that quote in your back pocket from Mark Twain. If I had more time, I'd write a shorter letter. I think that puts it into perspective.
So, would you say that communication is one of the most important or the most important thing being in a position of leadership?
Undoubtedly, yeah. On many levels. So let's just start with organizing teams and how a team gets started in their work is so defining. If it's clear, if they have clear objectives that they're focused on, you avoid a lot of waste downstream. And objectives aren't, like articulating to a team what to do. It's articulating to the team clearly what problems you're trying to solve, and then unleashing the creativity to allow them to go do it. But that's just the starting point. The tone of communication I said earlier is just so important as well. And just sharing some experiences. Some leaders are incredibly positive, and I love that attribute. But it has to be authentic, and a default of positivity can be energizing, but it can be vague as well. And so positive tones, high energy tones, coupled with clear direction. And then it depends on the situation as well. People need to know when you're having a conversation and when you have expectations. And so tone affects that, clarity affects that, and it sets the path for efficiency in the work that has to occur. It sets the path for engagement, how people feel connected, and just can eliminate a lot of downstream waste if you start off on the right foot.
So we know a little bit about, medical fields and business, but could you walk us through some of your daily tasks as the CFO of Mercy?
Yeah. So I was the CFO for 8 years at Mercy. I've been the COO for 2 years. For that entire time, and a little bit before that, I was the Chief Strategy Officer as well. And I've been at Mercy 25 years now, so my daily tasks have evolved tremendously during that period of time and in those different roles. And how I think about my work has changed significantly also. When I was leading a lot of innovative efforts like those that you articulated in your intro, it was very much team management, project management, executing on key strategies, and organizing teams and accessing resources and keeping us on time, on budget, and that sort of thing. And it's really hard work. It's exciting work because you go home at night and you know what progress you've made, and that's gratifying. And then you evolve into a leadership position where it's less about the daily tasks that you have to get done and more about, how do you create a culture that works effectively together? How do you align incentives? How do you inspire people? How do you lead change? And in that environment, it's about kind of your one-on-one interactions, understanding people, understanding what their goals are and objectives are, being open to input and ideas and supportive of those. I have a funny story that I tell in Mercy. It's not funny, it's actually a very real story that can maybe bridge the gap between medicine and business a little bit. And that is, as I've taken on a lot of those change initiatives over the years, I was often paired with a physician to execute this change. And those things that you listed, they're large-scale efforts. Mercy is an organization that's a $10 billion organization that has hospitals across 4 states and thousands of doctors. So large-scale stuff. And it's always been helpful to have a physician colleague paired with me to execute some of that change. And often these physicians are doctors who have had very successful clinical practices, but at some point in their career they decide they want to try some of this administrative stuff. And it's like clockwork. About a year into it, they come to me and they say, you know, Shannon, when I was a doctor taking care of patients every day, I went home at night and I knew, you know, what orders I had written, what lives I had saved, what patient I had helped. It felt good. I could talk to my family about that progress. You know, this idea of instant gratification. This administrative stuff, implementing these huge programs and leading the organization through change, I don't know what I accomplished every day. I know we did some things, but I don't, you know, I can't write a list of impact that I made every day. And I don't know how I feel about that. And my response has always been, yes, but you're going to wake up 3 years from now and you're going to look back and realize how different the organization is today than when you started it 3 years ago. And it will be extraordinarily gratifying because the change, the impact that you had over that course of time, even though it didn't feel like it every day, is tremendous. And yes, you helped, you know, 10 or 15 or 20 or 30 patients every day when you were practicing. But now what you're doing is affecting millions of people's lives every day. And it seems to resonate, you know, and probably something that might be particularly relevant today and just the fast pace that's driven by technology and people looking for kind of that instant gratification. When you're working in large organizations and large scale, you need to have a clear vision, and you need to stay committed to that vision because finding the impact every day is difficult.
So I'm wondering, since you run basically a hospital company and it's in the medical field, you're responsible for, you know, the lives of millions of people and hundreds of thousands of people. So how does your company run differently than other companies just because of that fact, because of that personal factor in there? You're just affecting the livelihoods of, you know, so many people.
We hope so. And that's the reality of healthcare, that you're helping people in their most vulnerable time, and people get into healthcare for that reason. And yes, we're a hospital company, but again, we have almost 500 ambulatory locations, lots of clinics, and we have a technology infrastructure in Mercy that's been nationally recognized for its virtual care capabilities. And so we're connecting to people 24/7 in their life now with technology in their homes, and you become part of their family in a sense. And so there's a serious responsibility associated with that. What's interesting is, you know, I think 10 or 15 or 20 years ago, the human impact in healthcare was reserved for doctors and nurses. And because of technology today, the human impact is actually available to almost every type of career or worker in healthcare. And it's actually created a really dynamic and exciting environment for young people who are more tech savvy and oriented to capture both in their careers, to capture that excitement and fast pace of a digital world, and to capture that sense of impact and human impact by being involved in healthcare. Mercy and I'm not going to go into all of it. You can read about it if you're interested. But we've invested for a long time in a technology-enabled organization. And one of the important decisions we made was in the late 2000s when healthcare at large was still debating the value of an electronic medical record, and we committed to it. And as a result, today we have the nation's largest longitudinal database of clinical information because of our scale and because of how long we've been doing it. And that led to a relationship with Mayo Clinic in the last couple of years where Mercy and Mayo have combined our data sets, and now internationally we're combining data sets. What's important about that is the structured data and unstructured data coupled with AI and all these natural language processing technologies today. You can make use of the data to improve the lives of people in real time. And in fact, our current strategic plan, a tagline is proactive predictive care in near real time. And it's because all of this data now through algorithms is being built into workflows that's predicting everything from when a patient will be discharged from the hospital and should they be discharged to the home or to a skilled nursing facility, to predicting what their total healthcare cost will be over the next 10 years and whether treatments will be effective or not. And so all this is converging right now through the data sets that are available and the communication technologies, whether it's mobile or texting or home-based diagnostic capabilities.
I have a question. So, what was COVID like? What was that? That must have been a hectic time for Mercy, and all hospitals around the world. But I don't really have a specific question, but I don't know. Do you guys have a question about COVID? Because
I mean, I just know I'm sure it was overflowing demand, and then you were talking about the resources. So how did you distribute those if you were able to, and then how did you adapt? Because I know obviously schools you have to adapt with online stuff with masks and things like that. But then what about after COVID? Do you still have things that have changed because of the pandemic that you've kept now?
Yeah. COVID. So I was CFO in Mercy when COVID was going on, and COVID was in my career one of the scariest things that has ever happened. One of the most difficult things to manage through, but also one of the most exciting times of my career and one of the proudest times of my career. It was an emotional roller coaster, to be frank with you guys. In the early days, we had no idea what we were up against, and it wasn't just Mercy; it was healthcare at large made decisions that to close, elective surgeries, all these general healthcare, anticipating. To your question about resource allocation, we need resources to be available to deal with this pandemic, and so economically, it was devastating for hospitals. Our revenue fell 40% in 2 months. And think about health systems that have so much fixed costs, are driven largely through labor, doctors, nurses, lab techs, a lot of people are required for healthcare. And so if you're having to make decisions to close a lot of your highly profitable business overnight and it cuts your revenue in half, you're then also having to make people decisions pretty quickly as well.
Well, I have a question. So if the business is like a hospital and you just get more and more patients, wouldn't that make the revenue go up?
Right, because there's more COVID patients.
They would
Right.
exceed capacity.
Because like if it was any other business, then it would make
I
sense.
thought it would be good for business.
Isn't that interesting? So a few things, and I'd rather not go deep into the economics of healthcare, but here's the reality. In healthcare, you make money on some stuff and you lose money on some stuff, and you try to keep it all in balance. And in general, what you make a lot of money on is surgeries and procedures and those sorts of things, particularly elective surgeries and procedures that are paid for by commercial insurance, because that's where your rates are the highest. That's the business we had to close. What you don't make money on is general medical care. And COVID early on, before CMS, Medicare, established new codes for COVID and gave us premiums for taking care of COVID. It was coded as pneumonia, which is a fairly low level of care in the grand scheme of things, and fairly low level of payment. And so we had this period of time where we were seeing the news broadcasts of all these ERs being inundated with patients. Before we were experiencing that volume ourselves, we made decisions to close this highly profitable business in anticipation so we would be available. So we had this gap where we weren't doing a lot of either. And then we were inundated with these COVID patients, which consumed our resources, but at a fairly low reimbursement. And so those dynamics were resolved over time through government intervention and different policies. But that was the reality of what was going on, like in the heat of the moment. And how do you make decisions like that as a large organization? And then I'm sure you all remember when the vaccine became available, and how much hope it drove, and how excited people are. Are we almost through this thing? Right? And then it helped, but then we had another spike, and you try to reopen services, and then you have to make the decision. All right, we reopened everything, but is this next wave going? And so let's not make that same decision of closing because it was so economically devastating. Let's try to keep it open. And then you're in a situation where you have a lot of both, and your resources are really, really strained. People are tired. They're struggling. How much longer is this going to happen? And so I'm just trying to articulate how dynamic over a few year period of time these decisions were. And of course, not only were we worried about our patients, we were worried about our coworkers. Can you imagine the nurses that were taking care of the patients and had to go home to their families every night, and the extra work they went through to protect their own families. Undressing in their garage, going straight to the shower, and then finally, feeling safe enough to sit down with their kids at night. The result of that was a lot of people chose to leave healthcare, and I understood that. I mean, that's a big lift, right? And so there were all these workforce issues going on, all these medical issues, a lot of just concern, and then all the public perception issues. And this is real too. You guys probably remember seeing news broadcasts where all these signs were put up. Healthcare workers are our heroes. Early on, we had in our Oklahoma City hospital, it's like the community self-organized, and there was a whole parade of cars that showed up in our parking lot one night. And the parking lot was pretty empty, right? Because we didn't have all these daily activities. And they showed up and they honked their horns, and the fire trucks came and they honked their horns, and it was the community expressing to the hospital how appreciative they were of what they were doing. And then we went through that period where it became very political. And last week, the healthcare workers were heroes. The next week, they were being questioned. Is this fake? And it was hard on our healthcare workers they were no longer heroes. They were, in some regards, the enemy. And why was that? It's because we had to make decisions around visitor policies. You know, we couldn't let people come into the hospital to visit their loved ones.
Yeah.
And so we became the evil empire. Why can't I go see my loved one? They may not be here tomorrow. It was really hard. We had nurses, that we used iPads and everything so that patients could communicate with their families maybe for the last time. And it was the nurses that were sitting with these patients when they were dying. So books will be written about it for sure. Those people that have lived through it have a whole lot of different emotions about it. And,
I guess we don't want to hold you for too long.
Yeah.
I'm sure you have important COO stuff to be doing.
it's Friday night. Hopefully not too much.
Yeah. But I guess like my last thought is just, especially when I was younger, obviously I know a little bit more now, but just when I look at hospitals, I think like doctors and nurses and then like surgeons and people like that, but I don't consider as much kind of the administration side of it, which is equally, if not more important to organizing everything and running everything smoothly. So thank you for your insight today.
Yeah.
I think we learned a lot about kind of the medical administration part of the field, and then also just like talking about interesting issues and AI and all that. So you guys have anything else to add?
Well,
No.
healthcare will always depend on doctors and nurses, and that's where a lot of the magic happens for sure. But I'd like to try to inspire people like you to seriously consider healthcare in their futures. It's a much more dynamic industry than it's ever been, and as I tried to articulate earlier, the convergence of science and data and technology right now, the next 10 years in healthcare are gonna be dramatic in terms of what's possible. And so we need really smart, energetic people who thrive in tech-oriented environments, and who are willing to ask the question, what's possible? It's another just kind of mindset that you guys should carry forward. Healthcare, there are so many obstacles. And if you start with the obstacles, you won't get very far. But if you start with the question, what's possible, and set a vision, and then knock the obstacles down one at a time, it can be a lot of fun. So not knowing what fields you're all interested in, I'm just going to put a plug in for healthcare because it's incredibly exciting right now.
Yeah.
All right. Thank you for taking part of your day to talk to us. We really
Yeah.
appreciate it.
Yeah.
Thank you guys. Appreciate it.
Thank you.